now I can welcome everybody to this first Recenter webinar of the summer term, or Trinity term, because this is Oxford. So each term we like to have a mix of presentations of our own work and input from others in the broad field of child welfare and development. And today we're delighted to welcome Ben Perks, who you can see on the screen. And Ben is an associate faculty member of the Social Policy and Interventions Department here in Oxford. But his day job is as head of campaigns and advocacy at UNICEF in New York, where he leads public and policy advocacy on development and protection of children. So he's previously worked for UNICEF in a wide range of countries, Republic of North Macedonia, Republic of Montenegro, Georgia, Kosovo, Afghanistan, India, and Albania, working on a wide range of issues from demobilisation of child soldiers through preschool expansion and addressing child poverty. So all of that makes Ben an ideal speaker for our series, but there are two particular reasons why we wanted to hear from him. First, as he's recently published a book, Trauma Proof, which is going to be the basis of his talk, and that really advocates for a public health approach to detecting, preventing and intervening against childhood maltreatment to achieve a trauma-free society that works better for all of us, but particularly children. And in particular, he makes a powerful case that this is both achievable and cost-effective. But the other reason that Ben's thinking is really helpful to us is that it's not just shaped by his professional work, but also by his own experiences of childhood trauma and his experience of the British care system. So Ben's going to speak for 20 or so minutes, and there'll be plenty of time for questions and clarifications afterwards. He has said we had a quick chat with him beforehand, and he's really happy, given that he'll talk to a sort of global stage. If there's anything you don't want to understand or want to check in, he would really like this, and we would like this to be a conversation. So if you do want to interrupt and ask a question, just put your virtual hand up if you're virtual, or if you're in the room, just wave at me and I will get Ben to stop and we'll ask your question. So I hope that's helped enough of an introduction about you're in the right place. Can I hand over to you, Ben, to talk us through your thinking?
Thank you so much. And I just want to start off by saying it's a real honour to speak to the Recenter. I love the work you do, and particularly full of gratitude for the work you do to promote the rights of people from children in care, which I think is, the group that perhaps is one of the most human rights violated in the United Kingdom and beyond, and very happy to have your dedication and your commitment to advancing better outcomes for children from care. So I just want to say, just for a couple of minutes, some people will know this very, very well, but probably most people won't really understand fully what UNICEF is. So I'm going to take a minute to explain that, because then that helps to understand how I came to this idea of a child development revolution that I've talked about in the book and that I'm going to talk about today. So UNICEF is a United Nations agency. It is governed by member states of the United Nations. In almost every middle and low-income country in the world, it's got a fully fledged, diplomatically accredited presence that liaises with government to help them and to advocate for them to fulfill the rights of the child as set out in the Convention on the Rights of the Child, and to achieve the targets of the SDGs, the Sustainable Development Goals that relate to children. Many of the countries, or some of the countries, are large-scale humanitarian operations too, responding to situations of conflict and natural disaster and famine. In high-income countries like the United Kingdom, we have affiliated bodies we call them national committees. So in the UK, it's UNICEF UK. In the US, it's UNICEF USA, US Fund for UNICEF, who are famous for inventing the trick-or-treat phenomenon at Halloween. So American students or academics may be familiar with that. And we, in addition to our national work, our work at the country level, which is, just to add, what's unique about our work at the country level is that it's nationally owned. So everything we do fits into rolling 5-year work plans with government that is agreed with government and then approved by the member states who sit on the executive board of UNICEF here at the UN in New York. globally, we have a role as well that we work with the United Nations General Assembly and with multi-stakeholder partnerships like Davos and elsewhere to really advance the rights of children globally. And one of the most powerful mechanisms that we work with is the Convention on the Rights of the Child reporting process, where every few years, governments, every single government comes to the Human Rights Council in Geneva and reports their progress, which is measured on the rights of their fulfillment of the rights of the child. So that's UNICEF. I explain that because often people, particularly in high-income countries, are not used to interfacing with the UN as a system because we primarily work in low and middle income countries. So often there's some misunderstanding of the role of UNICEF. So I wanted to explain that a little bit before starting. So UNICEF is my day job. I've also just written a book which is called Trauma Proof Healing Attachment and the Science of Prevention. And the book really, the book deals with healing. It deals with a lot of storytelling. It deals with a lot of science and data, and kind of talks about the different entry points for ensuring children grow up safe and loved, from parenting programs, parental leave, schools, the justice system, and addressing societal problems such as myth, stigma, shame, and also the problem of collective trauma from the Holocaust or slavery or the conflicts that we see around the world, and the way that permeates through generations. But the driving argument is that we are the first generation in history to know how to really dramatically reduce and potentially eradicate child maltreatment and bring child trauma, which, as I'll explain, has multiple costs for society, really under control. So how did I come to this idea? Well, the first thing is that as a young guy in UNICEF, I would be in an area, for example, northern Afghanistan, and I would have these crazy bosses that would come and say, there are 5 million children in northern Afghanistan. 95% of them have never been to school. You need to get them into school. You need to create a school system and make sure that they're all in school in 2 months, right? This is we can have a campaign called Back to School. And you had all of this access to resources and supplies, and you'd work with local leaders and local communities to make this happen. But the thing is, it was incredibly audacious, and you had to make it happen. It was the same with polio campaigns. We'd have a campaign where we'd be in an area in a low-income country with no roads and no infrastructure, and a child population of 3 or 4 million, and we would be expected to vaccinate them all against polio. And it was all doable, right? It was all possible. You just had to bring together a wide range of local partners and a lot of international support, and you could make it happen. But I wondered where this audacity had come from. And what I realized with time, because I was doing this kind of work in the early noughties, mid-noughties, what I recognized that with the generation before me had really been working in the 1980s. And in 1980, in University of Birmingham, John Rode, who was an American epidemiologist, presented a paper in which he argued that we could dramatically increase vaccine coverage and distribution of certain types of preventative and response solution to help children survive and heal from acute diarrhea or prevent acute diarrhea, and also, which was a killer, and also that we could support and help parents, mothers learn how to breastfeed and to monitor and help doctors monitor growth of children. So with these 4 interventions, vaccines, diarrhea prevention, breastfeeding promotion, and growth monitoring, we could really reduce child mortality. And so the head of UNICEF and the head of WHO came together and had a bit of a row about whether this was possible or not. And then they decided it was, and they went off and launched it as a campaign over a 10-year period. This was a moment of acute polarization as we have today. It was the height of the Cold War, the war in Afghanistan, not too long after Vietnam and Watergate. It was a very difficult time at the UN, but they managed to get agreement on this one issue of stopping children from dying. And within a decade of working with almost every country in the world, working with royals and prime ministers and presidents, mobilizing doctors and nurses and community health workers across the world, they increased vaccine coverage from 15% of the world's children, under 5-year-old children, to 80%. And they had similar outcomes for the other goals as well. And the decade that followed, child mortality was reduced by 61%. And this is probably humanity's biggest ever accomplishment. And it was called the Child Survival Revolution. And I think that it's not celebrated as much as it should be, but I think we have a lot to learn from the Child Survival Revolution. 15 years later in my career, I was in a completely different job. I was the head of office and the UN resident coordinator for the country of Montenegro. And it was a completely different type of programming. There was programming on disability inclusion, on things like youth participation, but there was a campaign we were launching on the institutionalization of children under 3 as part of a Europe-wide initiative. And I went to this presentation, to this launch, to give a speech alongside the minister. And it was kind of a formal occasion. I was wearing a suit and there were lots of media there. And we gave up our introductory remarks. And then a psychologist started talking about the impact on the emotional world of adults from a childhood without parental love in the care system, and why, as a reason why it was so important to institutionalize. And I was sitting in my seat in this formal event under the full glare of media cameras and all that. And I realized at some point he wasn't just talking about the children I served, he was talking about me in a way, and everything that I had kind of suppressed about my childhood, and on the surface being somebody who was quite successful and had a master's degree and, you know, played football and rugby and had a great job and all of this stuff. But below the surface, I realized that I probably had post-traumatic stress disorder and very insecure attachment, and that most of the relationships that I was having in my life were actually relatively superficial. There were people that I loved, but I didn't spend a lot of time with them. And all of this came out. I decided on the spot that I was going to call a friend who was seeing a therapist and set up an appointment for myself. And I went into therapy for really over a year. And my world went from black and white to color. And, you know, it was just revolutionary in my life. And then a few years later, I was holding my son in my arms at the maternity ward here in New York. He'd just been born, and I was with my wife, and I was holding him in my arms, and I was obviously completely consumed with him and just observing him, but there was a thought flickered across my head, and it was that what had happened to me had become unimaginable to myself. I knew that I would walk to the ends of the earth to protect this child and ensure the best possible life. And I realized that the intergenerational cycle had been broken. And so then at some point soon after, I began to think, well, if I can do it, why can't we prevent it in the first place? And can we help on scale those that are already living with child trauma so it doesn't get passed on to their children? And then I thought about it as a child, you know, from my earlier experience on the child survival revolution. And could we not have a child development revolution? And that was the basic idea of trauma proof. It's also informed a lot of the global advocacy that we do as UNICEF. For example, we were recently at the Bogota, the first international interministerial global conference on violence against children. And we built our advocacy narrative with other partners and with ministers around this idea of a child development revolution. So why should a child development or protection revolution be a priority? Well, it's important to recognize that until recently in public policy, we've primarily talked about abuse and neglect in terms of the 1 to 2% of the child population who are either in contact with the law or in the care system. But one of the revolutionary things that's happened over the past 20 to 30 years has been the accumulation of population level data on issues of risk factors for child trauma. So the obvious one is ACEs. Most of the ACE research is not actually population level, it's an indicator. But if we look at adverse childhood experience research, I think you all know what ACE studies are. It's studying the 10 risk factors for trauma, so emotional, physical neglect, physical, emotional, sexual violence, and then dysfunctional parenting, such as intimate partner violence, undiagnosed mental health, addiction, and so on. And 57% of adults across 37 countries, across all continents, have one adverse childhood experience, and 13% reported at least 4 or more. In some countries, particularly countries where there is a massive organized crime and drug epidemic, like in parts of Latin America, ACE levels are higher. Also in countries such as Russian Federation, which have had a very difficult transition, particular epidemics of alcoholism and other things, you see higher levels. In other countries, you have slightly lower levels, but across the board, we have broadly similar levels and prevalence of adverse childhood experiences. But what we also see is not just that the prevalence is much greater than we ever thought before, but there is almost a dose response correlation between the number of ACEs that somebody has had and the negative life outcomes across health, education, well-being, but also in terms of risk for crime, exploitation, and violence. And I'll just go through these a little bit. So this is a slide from the Center from Disease Control in Atlanta, which many of you would know, and perhaps some of you would work with. This is a aggregate of 40 different well-being indicators, and you can see quite clearly it looks like a set of stairs. The more ACEs somebody had, the more likely they are to score negatively across that entire range of 40 different well-being indicators. And it's things like depression, but also and mental health issues, obesity, addiction, but also things like osteoporosis, non-communicable diseases, and other types of problems. And we also know, particularly, and this is data from the National Health System in Wales, we also see the dramatic increase in risk for children that have for ACEs or more, or the more ACEs a person has, the more likely they are to be incarcerated, to be a victim or a perpetrator of violence. And growing up from care, I know this because we were the type of kids that the gangs would try to recruit. Girls in care were the type of girls that gangs would try to exploit. When we look at radical groups, gangs, extremists, even in parts of the world where organized criminal groups try to hook kids on drugs so they have a line of custom, they go after kids who are somehow having higher adverse childhood experiences. And I think you see this in the UK with grooming gangs, with the county lines, the evidence, and with radicalization, both on the right and also in terms of Islamic radicalization and others. There seems to be evidence that there is a very strong correlation between ACEs and exploitation and risk. And the cost of this is enormous. Like in North America and Europe alone, the annual costs of just the health impact, not the crime and everything else, just the health impact of adverse childhood experiences is estimated very conservatively to be around about $1.3 trillion dollars per year, perhaps a lot more. And globally, we know that again, and this is the beginning of the science of understanding the economic costs of adverse child experiences. But a very conservative estimate, we think that ACEs cost at least 8% of global GDP annually, though it's likely to be much higher. The Office of the Special Representative on the Secretary General on Violence Against Children is doing some more detailed costing of this. So are the colleagues at Oxford's the Department of Social Policy and Innovation. They're looking specifically at comparing the cost of cases that are unaddressed compared to the intervention to address them through scaling up parenting programs, which I'll talk more about in a minute. But the important thing to remember after all of this horrible bad news is we are the first generation in history with the knowledge to end toxic stress, child trauma, child maltreatment, and these kind of risks. And if we can achieve that, that would have ripple effects across society. I was listening to the podcast that probably some of you listened to it, Rory Stewart and Alistair Campbell. Some of you probably hate it as well, but I was listening to it the other day, and Rory Stewart made a really important point. He said that in the 21st century, despite all of the AI and electronic cars and all that, there's no innovation or invention that has really driven humanity forward the way that innovations and inventions did in the 20th century, like the seatbelt or the vaccines or piped water. So perhaps if we can address this problem using innovation and science, it would be the one thing that our generation really contributes to humanity. Not only are we the first to know that how to end toxic stress and child trauma, we should be the last to accept it as an inevitable and insurmountable problem. So what a child development or protection revolution looks like to me is ensuring that every child grows up with healthy connections, because healthy connections that make a child feel safe and loved are the most important protective factor in the life of a child, but also the most important factor for the development of that child. So I think firstly, we have now, and there's a World Health Organization systematic review 2 years ago that showed from 435 randomized controlled trials from across the world that a minimum package of parenting programs, home visits, perhaps backed up by apps and other things, universally available and progressive, can have a huge impact on outcomes in terms of prevention of abuse and neglect, in terms of developmental outcomes, learning, word acquisition, and all of that, but language acquisition and all of that. But also, surprisingly, there was an unintended benefit, and it takes me back to that maternity ward. It's that parental mental health improves when they're able to have a better relationship with their child. Why? Because love heals. I asked Bruce Perry about this finding, and he said that to him it's obvious because parenting is reciprocal, right? The more you're able to express love and connect and bond with your child, the more comes back to you too. It's healing. So that's the first thing. Just to add that it was parenting programs that were very much cited in the research of Heckman on early childhood development. This is sometimes contested, but it seems to be very much backed up by other research that the investment in early childhood, particularly in the parental relationship with the child, can yield up to a 13 for every dollar invested, up to a $13 return. We seem to know from research across the board that investment in early childhood and early prevention yields a huge return for children throughout the entire life cycle. Secondly, we were speaking to Helen about this before, the importance of secondary attachment, ensuring that every child comes to school is safe, seen, and soothed when needed. And this is really important for all children. The research of John Hattie at the University of Melbourne, he has done, like, it's a nerd's charter. He's gathered every single piece of major research on learning outcomes all the way back to the Second World War, end of the Second World War until now, and it's created like a league table of what things make the most impact on learning outcomes, and it's relationships. So relationships are important in school for every child. If you ask people what they remember from school, even when they're old, it's a teacher. It's not the hours they did or the shape of the classroom or the architecture. It's the teacher always. But for children that are not loved at home, that connection is really, really important. It is potentially a game changer. I wouldn't be here today speaking to you if it wasn't for my teacher. I talk about this in the book. Her name is Jan Reports. She basically saved my life. I would have, I doubt I would be around today if it wasn't for her helping me to find a different pathway out of trouble. And the Melvin Bragg, who is kind of a very, very old now TV celebrity in the UK, still going, but he's interviewed every celebrity and every writer and everyone you can imagine, going back all the way back to, I guess, the 1950s. And he says that always, when it's somebody that came from poverty or dysfunctional family, always there was a story about, it's this teacher. So it's really important to recognize that secondary attachment in schools is really, really something that can be a game changer and should be, very much written into the policy and the curriculum development of teaching itself as a practice. And this is also especially important for children who are preschool age. Half of the world's preschool children don't go to preschool, which itself is a problem that I have access to preschool. But for if we wanted to ensure that we reach children with that secondary attachment, while the brain is still developing at a rapid pace, ensuring that every child is in preschool with a connected, attuned teacher is something that would be a great investment. And finally, targeted care, support and response services for children at extreme risk of violence and neglect who are not protected by the primary or secondary attachment. It's really important that social work or that mental health intervention is really trauma informed, I guess. I know that's like a buzzword now. I don't always know exactly what it means, but that it's the trauma, an understanding of trauma and what it does to neurobiology of the child is fully understood, but also the importance of relationships is put at the center and heart of social work response. This is something that this child development, child protection revolution is something we can do together. I hope you join us on that journey. I'd like to open it up to questions now. Thanks.
Perfect timing. Thank you so much for that. While people are just starting to think about their questions, you've got rounds of applause, as you can see. Has posted in the chat that people in the chat, you can put your question in the chat, you can put your hand up, which would be easier for me to just manage. And I will start by a question, so Chair's prerogative, I guess. I am reading your book, I haven't finished it yet, but one of the things that struck me was those three levels that you spoke about, the sort of protective layers of primary attachment to parents and carers, secondary attachment through schools and community, and that third layer of sort of societies and more systemic change. And they very much resonate with the three areas within our the Recenter strategy around practicing care, practicing education, and sort of policy and system change. But I wonder what your experience is of what we best need to do to sort of make sure that all of those three levels are operating together from your experience. Have you got any advice for us?
I think that what's really important is that we refocus on outcomes. I think we get lost when we don't focus on outcomes. I see that in every kind of institution. When institutions focus on protecting departmental space, or they're unable to find a common language with other professions to be able to work together, I think it's because they've lost sight of outcome. So I think that's really important. Sense of mission driven by outcome, which needs outstanding leadership. I think we need also, one of the things you see as a UNICEF representative, like a head of a UNICEF office in a country, is that you have to be a cross-cutting expert, and then you lead this team of different professions, some working on health, some working on humanitarian response, some working on education, some working on early childhood development, and trying to get them towards a common mission, normally around 2 to 3 really simple outcomes that you want to improve. That to me is the best way. I think that's really the only way that I've seen work, is having that kind of cross-cutting leadership that's clear on mission, and then getting people, the different sectors, into solidarity around that mission. But also that requires having the architecture to measure and monitor outcomes. We now can monitor really what happens to kids, for example, in care. Do they go to school? Do they form relationships? Do they feel loved? Do they feel safe? Are they happy? These kind of things we should be driven by. And I think that's not as easy as it sounds, but I think it's doable.
Great. We've got a comment in the chat rather than a question, but I'll just make sure that you have got access to it from
Florence, yeah.
Yeah, maybe you know Florence already. She's just saying it's so important to make people aware that your book is very useful. Your book is very useful for that. But talking about the benefits for parents, not just being that loving children is healing, but it enables them to be available to their children, and helps children then resolve some of their own trauma. So thank you for that, and that sort of ripple effect. Really nice response there, and some links to other people in the chat for some of the family-based solutions. I have Leon Feinstein in the room, who you may know, Ben. He's our director at the Re-Centre. So Leon, ask the next question.
Thank you. Hello again, Ben. You very kindly spoke at an event for my module on child rights a couple of years ago. Very powerful. Thank you. Good to see you again. I just wondered about the difference between a revolution around vaccination and one around getting rid of abuse and neglect, and the difference in those experiences and policy mechanisms. I mean, vaccination, I guess, is a policy mechanism that, in quite a straightforward way, breaks the link with disease. Although there are behavioral elements, because people might choose to engage or not, and there are resource requirements, it is the kind of thing that the UN can create, and almost, there are levers of resourcing and institution building that the UN can lead, and it can, in quite a almost mechanistic way, lead to the vaccinations, which lead to the improvements in health. And the science of that and the delivery of that is relatively straightforward. And I'm just thinking abuse and neglect, or however you define experiences of concern here, are very different, in the sense that, yes, we know something about interventions, but there is a great range of different sorts of interventions with different types of conceptual frameworks and different types of evidence. The levers are very different in that there are actors and operators in society that may at times be drivers of abuse, and neglect may happen in the margins when people's resources and capabilities don't meet needs, and those are very different sorts of challenges to address. So I just wondered, in drawing that parallel, how you see the learning from an approach about vaccination to the topic that you're addressing here, and related to that, who's the we? As in, is this about the UN? Is this about central government? Is this about individuals? What I'd be just welcome a bit more of your thinking there.
Oh, you're on mute again now, Ben.
Yeah, that's a brilliant question. Thanks, Leon. I think, to work backwards, when I say we, I mean humanity, right? I mean, the child survival revolution happened because humanity was able to coalesce around a really important thing, which you often can do with the right kind of communication and leadership. Firstly, I'm going to answer the question with two components. The first is that vaccination, breastfeeding promotion, growth monitoring, and prevention of diarrheal diseases is much more complex than it sounds. You have to create a cold chain system in areas where there's no electricity. You have to create a logistics system to deliver billions of vaccines. When the COVID vaccine was being kind of created, UNICEF had to pre-position billions of vaccines to different parts of the world so we could roll it out. And then you got all the behavioral stuff around the people accept there is somebody going to really turn up and manage the cold train thing, so that in the areas of electricity, so the thing doesn't collapse. There's so many different considerations. So it's not simple. And then the other part of the equation because I'm trying to simplify this intervention, right? Children growing up safe and loved. It's not like a really, I mean, people think about it really hard, and there's a meta review that looks at the different approaches, but evidence-based parenting programs now, broadly speaking, the science is settled on what works. A minimum package of parenting programs in the first year of life, maybe 6 or 7 visits, followed up by, secondary visits at critical moments of child development, such as the onset of adolescence or other moments, and then having that maybe backed up by some very low cost group activity or resource over time, is fairly doable and fairly easy to manage and fairly cost effective. The second one is, again, with schools, just about, Peter Fonagy, if you listen to Peter Fonagy, he talk about his teacher. He says that all the teacher did was give all the kids a book and one or two other things that just made them recognize that they mattered as an individual. We're not asking teachers to get fully engaged in the life of the child, but just to reset the self-view that comes out of a childhood where you're deprived of love and safety, that you do matter, that you can do something with your life, that that I'm looking out for you while you're in this school. That also has a huge reset. These are two kind of relatively low-lift interventions. Parenting programs, according to a lot of the work of your colleagues at the Department of Social Policy and Innovation, a lot of the research they're doing shows how we can really get the costs down on this. And the setup costs are a bit of an investment, but the recurring costs are maybe not that different to providing a full range of vaccines for a child. So I think it is doable, but we need to simplify at a global level what we want to achieve for every child. For high-income countries too, our son was born in New York State. In New York, 60% of people have got one adverse child experience. Over 17% 4 or more, less than 5% receive parenting programs, but the parenting programs that are being rolled out in different parts of the world were designed here in the United States. So it doesn't make any sense. So I just think we need to recognize that every single major intervention that propelled humanity forward was considered to be completely mental and harebrained before it happened. But when it gained momentum, it became increasingly obvious that it was achievable and the benefits were irreversible. Last point, I know you're interested in child rights. I think that human rights, which is under attack at the moment, only regenerates and rejuvenates itself if it links up to the latest science and knowledge that people are talking about in their communities. Regardless of all of this, if you go into your local bookshop in the centre in Oxford, half the non-fiction books are about parenting or child trauma. People are up for a conversation and action and change on this. We just need to channel that to the common public good. I hope that's a good answer.
Very good answer, thank you.
Really helpful, thank you. Helen, you had your hand up and then it went down, then it went up again. Do you have a question?
Yeah, it was similar to Leon's, but I'm going to add a different thing. So I was interested in what's the mechanism to then deliver this message of prevention. But I suppose more specifically then I'm wondering, what's the role or the trade-off between having like a national government maybe or some national leadership behind it involved versus that local expression? Like, how does this get done? Does that make sense?
Yeah, we're having a conversation with Mexico at the moment, and the way that it's working is the central government is showing real leadership on the idea and creating some of the architecture to monitor progress over time, some of the training support to strengthen the ability of the education system or the health system to help parents and to help kids. But then the implementation is done through services that are provided locally and making sure that they're, again, connected by outcome. Like if they're, like when I speak to one of the crises of public service that I see in the UK now, when I speak to people, is everybody's so down because they're bugged. There's no vision of outcome. What do we want to change in the world? The possibility that we can massively change something in our society, that sense of agency. And I think that when that vision and message is put together, in many countries you can see rapid change. I think it's interesting to look at the situation of children in Estonia. Like, Estonia has got incredible outcomes in terms of learning outcomes, but it's also got incredible investments. Like, it's got probably the best parental leave package in the world, according to UNICEF, measuring them, because who measured them. And I think that's because they had a vision that's what they wanted to achieve. It's easier because it's a small country, but well, maybe it's not easy. I don't know, but it's a small country. But they came from a very difficult Soviet past, and they completely revolutionized everything. And I think it's having that vision communicated, understood, and accepted. One of the challenges that we have in making all this happen is navigating cultural wars, right? Is making sure that parenting, mental health, protection that can be contested sometimes, that we navigate them through these different divisions in society and build this commonality. That's what they had to do in the child survival revolution too. It's not a great answer because I'm not very familiar with decentralized local services and national, but that's what I think would help from what I see.
This is a good sense, thank you. Julie Selwyn has asked a question in the chat, which is around given that negative developmental effects often happen before birth, for example, through maternal drug use and so on, how can we sort of change that? And particularly, I think she's thinking, she asked the question when you were talking about parental parenting programs and sort of recognising that those parents often aren't engaging with those programs. So just wondered about your thoughts on that.
My argument is that parenting programs have to be universal, but not compulsory, but they have to become a norm, like a vaccine, because you remove the stigma as well and all of that. I think that there has to be targeted support for people when they come into the perinatal system and before, on things like addiction and domestic violence. But we also have to have a much greater awareness. I was speaking to my in-laws the other day, and they noticed that we do everything to avoid an argument in our house. And it's not because we're avoidant of arguments, but it's because we understood the science that when Anna was pregnant, that tension and stress and all of that can potentially have a negative impact on the development of the child and how development. We read it and we were alarmed about it. So we had like a no argument. Some people think it's not great to have a no argument policy, but it was just a temporary thing. But it was the awareness. And then the in-laws said, well, I didn't know that. And they don't know. And most people don't know that things like toxic stress from domestic violence, from rowing, from tense relationships, from a horrible boss, and things like alcoholism and other things can have a huge impact on the child. We need to make child in the womb. We need to make the whole of society aware of that. And then we also need, for example, if it's the workplace, we need to make corporations understand there's no such thing as a parenting neutral workplace. Corporations either help the parenting process or they make it worse. They exacerbate vulnerability. So I think that we need a whole of society understanding of how we protect pregnant mothers and their babies. It's not a great answer. I'm not fully, the others will give a better answer, but there's some thoughts.
Okay, thank you. We've got Harriet Ward in the room here, so who's going to ask her question? Harriet.
Hello, you anything about the impact of poverty and destitution on all of this? We know that there is a relationship between poverty and abuse, although it's a very complex relationship, and poverty doesn't necessarily lead to poor parenting, but it certainly increases the stresses within a household that you were just talking about, and it makes abuse and neglect more likely. How do you fit that into your programme?
When you say my programme, what do you mean?
Your plans. We're at the moment in a situation, aren't we, certainly, where there is an increased disparity of wealth, huge differentials in income, and certainly the charity of which I'm a trustee is encountering huge levels of destitution in families in and those families are under exceptional stress, and the chances of abuse and neglect will be more likely in those families. So how can your plans encompass those issues?
So I'm going to put my UNICEF hat on because a lot of this stuff I was talking about from a personal perspective, but linking it to work. I think there are four. Actually, this is more of my personal view. I think there are four catastrophic burdens in childhood that bring negative potentially outcomes throughout the entire life cycle. So one is poverty. Second one is discrimination. A third one is adverse childhood experiences, toxic stress, and the fourth one is humanitarian crisis. So of course we have separate programs on poverty, on discrimination, for example, girls' exclusion in Afghanistan from school, or exclusion of children with disability. We have a lot of work on child poverty, on social policy. We do a lot of advocacy on universal cash benefits. I've worked in countries where we've advocated successfully for government to increase spending to address child poverty. And we obviously work on humanitarian stuff, but these are four different things. And if I'm trying to break the taboo and the myth and the stigma around adverse childhood experiences, I don't want to talk about any particular group, because sometimes in the attentional world, it can mean that I'm not acknowledging somebody else's pain. For example, I'm from a children's home. I come from the bottom 1% of the United Kingdom, affected by poverty too. But I was recently speaking to somebody that came from the top 1% in our country, and they'd gone to a boarding school, and they had exactly the same emotional poverty that I had, right? But they'd had other kinds of privilege. So I'm in this work and in Trauma Proof, I just want to focus on the neurobiological impact of not growing up safe and loved. But I recognize there's so much other work on child poverty, and I work on that as well, but I try to keep it a little bit separate because I'm an advocate and a campaigner, if that makes sense. But I acknowledge everything you say about the link between the two. Are you happy with my answer? Because I can't see you very well there, but
Yeah, that's fine. Yeah.
it makes sense. Okay, good.
Great. Any other questions while you're thinking, Ben? I just wondered, you sort of touched on it a bit with, I think it was Estonia, but are there sort of countries that you particularly point to that have done this really well? Just thinking particularly about that point around sort of emotional poverty and addressing that and feeling safe.
No, I think we're at the very beginning of this. So we didn't have, the timeline, you had the attachment research that really began after Second World War, but you didn't have much until, in terms of policy impact, for population level, until the ACEs stuff. And that really began to come out in the late 90s. And then the stuff around toxic stress and Harvard and all of that is very, very recent. So this is only beginning to impact policy in high-income countries right now. But it is a theme of the moment because there's a lot of public interest in it as well. So I think we're able to harness that to accelerate change. There are countries that do much better, countries that do invest in things like parental leave. Like I did a whole chapter on parental leave in the book and how important that is. So we have a whole league table, and at the top of it, as you expect, are Scandinavian countries. Also the investment in the education system, countries like Finland, and the way those schools are managed, where play and relationship and belonging is part of the process. So they're good examples. In terms of parenting programs, about 25% of the world's countries have parenting programs that they say are scaled up, but there's none that has universal yet, and that's where we need to get to.
Great, thank you. I had a bit of an argument with someone in a previous job about universal versus targeted parenting programs, and I've been on a universal one, but in a targeted area, and it was actually really, really thoughtful and thought-provoking. Yeah. And so parents doing it was really important. So Leon's got another question in the room, but I think Helen put her virtual hand up first, so I'm going to prioritise Helen first, and then I'll come back to Leon.
Thank you. So I was delivering a lecture a few weeks ago, And is my connection okay?
We can hear you, Helen, just can't see you, but that's fine.
Yeah. For some reason, it's decided not to work. Okay, and so I was approached afterwards, and after I was talking about educating children who had experiences of trauma and neglect, and know how schools could be more, and teachers could, develop practice to make it more sense of belonging. And part of the lecture included a bit of the background, so some of the rates of children in care and children with a social worker in this country. And afterwards, one of the students came over to me and said, "Oh, when I hear a lecture like this, it makes me think the UK is quite a gloomy place." And he said, how do you think it compares to other countries? And it got me thinking to ask you today, do you think there's a connection between countries that monitor and have a high rate of research and kind of knowledge about what is going on in their country? So I think, personally, I think the UK is good at knowing what's going on in the country. We haven't solved everything and we haven't resolved it all, but we know poverty. We know about, children with a social worker and their rates and how that population changes. But we haven't solved the issue. But with your knowledge of other countries, is there a relationship between countries that are monitoring it well and doing things well? And are they gloomy?
That's a really brilliant question. I don't know. I haven't got a correct answer for that. I'm working on a global caregiver forum that we will host with the Queen of Spain in January in Madrid. And I had to call, probably 20 different countries to have a conversation about how we would get their country, the community of foundations and decision makers in their country really engaged in this process, because it's trying to build the architecture for universal parenting. Like they have a UN build up towards a UN summit, UN resolution, a fund, all of that. And Britain was the one in the moment where I walked away from it feeling the least motivated, because there was like this kind of lack of agency and inertia. Somehow there was this kind of sense of, it almost felt like learned helplessness. Like we can't really do anything. The situation's a bit shit. Pardon my French. And it kind of, I get that vibe a little bit, like the country's going to the dogs and all of it. When people come over from the UK to New York, when we've got loads of problems in the US, it's always this sense the country's going to the dogs and all of that. And I don't know if it's like the way we are now. I've been out of the UK for a long time, but you do get a sense of gloominess around change, the possibility of changing things in the UK. I don't know where that comes from. I suspect that it's not related to data on the extent of the problems we face, because America has also a really clear understanding. The United States is a very optimistic country, and it has a very clear understanding of the social disparities, the costs of things like gun crime, drugs, the problem of parental leave, the impact that has on child development. These things are very, very well known, very well reported, and still the US has a really can-do mentality. It's really upbeat, but things do get bogged down in Congress because of really complex politics. But the mentality or the attitude is upbeat and positive. But I can't answer your question. Those are just some thoughts.
Thank you. You're very good, Helen, at thinking about sort of lateral questions. Nice one. Leon, you had another come in.
Yeah, thank you. Partly I'm interested in the evidence around parenting and the work that colleagues in social policy are doing, because I think there's a lot of evidence that parenting programs can be effective at the margins around some outcomes, but relatively small effects and very difficult to scale. And as we've said, engagement. I don't know what kind of modelling has been done about the degree to which, through universal parenting classes, we are going to have substantial reductions in abuse and neglect. And I'd be really interested to see that evidence and analysis. I just wonder if we might do a separate session with social policy that you might come back to and speak at, but focusing more on some of that data and evidence. That would be really interesting. But and that's something we might explore. But my question really is about your revolution, or the revolution that you specify, and what how you see that progressing. Is this something that you're able to operationalize within UNICEF? I haven't quite understood the kind of, Eric described it as a plan. I don't know if it is a plan exactly, but I think we'd be very supportive here of what the ambition is, and I wondered what your next steps were, and whether it is at that level of kind of detail, or where it's more just a statement that you want others just to come in behind. But what's the plan?
Yeah, so just to go back to the first bit of the point, and just to give a very brief response on that, and then on the plan. So we work obviously very closely with World Health Organization on this, and this is one of the things that we asked like a couple of years ago with some of the really senior scientists that work on child development. Do we have got evidence to act on calling for scale up? And it was clear that the evidence is not perfect. Like with scale up, we've still got a long way to go. But we do have enough to act, and we have enough that is an imperative from a human rights framework to act, that we need to act. The research that Bowlby and Ainsworth, many decades ago showed that when parents have a chance either to process their own trauma, lack of love and security in childhood, or to strategize about their own child's development, that they are much less likely to transmit the trauma and that of the poor attachment. And that was observational research. And this kind of latest thing with the meta review that WHO led helps us to look at something that gives promise to that from a systematic process. So then on how do we make this happen? So yeah, we're trying to make it happen. UNICEF and World Health Organization, colleagues like Lucy Kluver at Oxford, International Rescue Committee, the SRSG, Special Representative of the Secretary General on Violence Against Children. We're working together to around these three kind of accelerator areas that I described at the end of my presentation, to systematically put in place similar architecture to the architecture that led to a revolution in child nutrition or education access or vaccines. So we're having a global forum, for example, that the Queen of Spain will host, and Spanish government with UNICEF and WHO. It'll be invitational. About 40 governments will come, different thought leaders, academics. We hope even a couple of celebrities, and they'll come together to form a critical mass that will develop a roadmap for how, over the next 5 years, we try to get breakthrough in scaling up parenting programs. It might lead to a UN summit where all member states come together. It might lead to a UN resolution, maybe a fund. All the time, we're working with groups of countries. We're working with Mexico, South Africa, South Korea, other countries to try to push scale up of these programs, and then get those countries that are championing this into a critical mass within the UN to promote it as a global good. We hope it will work. We're replicating what's worked globally in history, and then we'd like to have a similar one on schools. At the moment, and Helen would know this very well, at the moment we don't have a meta review of school programs. We don't have a systematic review that I know of that could drive global policy yet, but that needs to be something that also is developed in the future. I don't know if that's a good answer, but that's
another great answer. Thank you. I'm just wondering if you had much to do with the Royal Foundation in the UK, which, since you're dealing with the Royals in Spain, I understand that Royals here are very committed to this agenda as well and would be interested.
Yeah, we have some contact with the foundation. It's been a bit of a difficult time because of the situation of Princess of Wales. So we're going to, but they will get an invitation, and we will engage with the Royal Foundation on the forum for sure. Yeah.
Thank you.
Okay, well, bang on time. It's 1 minute to 3 when we're due to end. But then huge thank you from all of us at the Reece Centre and all other attendees at this webinar for coming and sharing your thoughts and encouraging us to read your book. As I said, I've bought it, and with my own money, I hasten to add, and really enjoying reading it. engaging. I like the sort of stories and the narrative approach. So there's a plug to others. It's an easy read. Not the content, but the engagement is easy to engage with. So thank you for the book. Thank you for coming to us and giving us this webinar. And we will, it sounds like, be inviting you back to a future webinar with SPI on parenting interventions. That sounds like a good shout. So huge thanks for your time, and thanks for everybody for joining today and for your questions and engagement. Please do drop us any points in the chat that you might want us to follow up on. And huge thanks to everybody. Enjoy the rest of your Tuesdays. Thanks, Ben. I know you needed to get up early to do this, so huge thanks for doing that.
Thank you so much. Thank you. It's been great. Thank you.